On October 28th, the U.S. Department of Health and Human Services announced it was recalling more furloughed workers. This time, the workers will be recalled to help process the applications that states are submitting to get a share of the Rural Health Fund. That's a fund that was established by the federal budget to help mitigate against some of the impact of the Medicaid cuts in the federal budget. It's some of the staff from the Centers for Medicare and Medicaid Services and the Health Resources Services Administration that are being recalled to help process those applications despite the ongoing shutdown, because states are to receive their money from those grants before the end of the calendar year. Recall, the Centers for Medicare and Medicaid Services had already recalled all of its furloughed workers to help with the Affordable Care Act and Medicare open enrollment periods, with over 3,000 workers demanded back to work as of October 27th. Some of those recalled workers will be the ones assigned to help review the Rural Health Fund proposals, along with some of those Health Resources Services Administration workers, specifically from the Office of Rural Health Policy. This is the team that has insight into healthcare provisions in the less populated parts of the United States. With a stalemate in Congress, the federal government remains in a shutdown. Part of the stalemate is attributed to the debate over the cost of health insurance, including enhanced premium tax credits and the dramatic cuts to Medicaid in the federal budget. As the shutdown continues, some federal workers were either furloughed or fired, making it harder to continue with operations like Affordable Care Act and Medicare open enrollment and the review of applications for funding like that coming from this Rural Health Fund. The U.S. Department of Health and Human Services didn't specify for how long the employees would return. People are speculating that at least the Centers for Medicare and Medicaid Services employees would remain during the duration of open enrollment and the HRSA employees for the duration of the grant review process as long as the shutdown continues. We link to more information about recalled federal workers in the description below.